Good afternoon. First of all, I want to thank DPI Con for having us here. It's a privilege to be here and talk about what we at Ola Foundation have been doing in the district of Krishnagiri. Before I start, I just wanted to go back and touch upon what DPH Director Dr. Soma Sundaram sir had said. He spoke about resilience, and I think when we talk about resilience, it also comes with various dimensions. Resilience also means that is the system aware enough about its own self? As I was saying that I wanted to touch upon resilience because one is the theme, and second, in order for us to look at resilience, we have to look at from both the sides as to the supply side and demand side. We started working in the district of Krishnagiri almost in the last year and a half. We have had some good support from the DM sir, from Ramesh sir, who helps us in many ways across the 6 blocks of Krishnagiri that we are working in right now. What we want to present today is not just from one aspect of the health system, but I think for us it's important to see where the supply and demand side converge, because it's important to see when these two sides meet together, that's where music happens. What I want to start with is a short video of a program that we run in the district of Krishnagiri across 6 blocks. The idea is to bring together both the supply and demand side. The idea is to see how can we create a community-centered solution which is owned by the community, and how empowering those 2 or 3 critical community processes, typically focusing on Village Health Nutrition Day and Patient Support Group, we can leverage a lot of community movement across the spectrum of 6 blocks. May I please have the video?
வாருங்கள் பயன்பெறுங்கள். அன்பார்ந்த மக்களே, உங்களுக்கு வணக்கம். நாங்கள் ஓலா ஃபவுண்டேஷனில் இருந்து வருகிறோம். 18 முதல் 42 வயதுக்கு உள்ள பெண்களுக்கு ஹீமோகுளோபின் பரிசோதனை. வணக்கம், என்னோட பேர் பிரியங்கா. நான் ஓலா ஃபவுண்டேஷன்ல 2024ல இருந்து மார்ச் மந்த்ல இருந்து தளி பிளாக்ல ஒர்க் பண்ணிட்டு இருக்கேன். ஸோ எங்களோட ஒர்க் மோஸ்ட்லி பாத்தீங்கன்னா ஃப்ரண்ட்லைன் ஒர்க்கர்ஸ், அது விஹெச்என், எம்எல்ஹெச்பி அவங்க கூட தான் இருக்கும்.
என்னோட பேர் அமரேஷ். நான் தளி பிளாக்ல ஃபீல்ட் அசோசியேட்டா ஒர்க் பண்ணிருக்கேன். நம்ம மோட்டோ ஆரோக்கியம் எம்எல்ஹெச்பி, டபிள்யூஹெச்பி, ஆசா ஒர்க்கர் இவங்க கூட சேர்ந்து தான் நம்ம அரௌண்ட் 120 வில்லேஜஸ் கவர் பண்ணி ஒர்க் பண்ணிருக்கோம்.
நாங்க இது ஹில்ஸ் ஏரியா. இங்க ரொம்ப வசதி எல்லாம் கம்மி, பஸ் வசதி எல்லாம் கிடையாது.
இதுக்கு முன்னாடி நாங்க லிஃப்ட் கேட்டு போவோம். இந்த சார் 1 இயரா வந்ததுனால கொஞ்சம் ரொம்ப ಹೆಲ್ಪ್ಫುಲ್ இருக்கு ಎங்களுக்கு.
ಮಕ್ಕಳಿಗೆ ಇಂಜೆಕ್ಷನ್ ಎಲ್ಲ ಹಾಕ್ಸೋದು ನಮ್ಮ ಕೆಲಸ. ಹಿಂಗೆ ಮಾಡಬೇಕಾದ್ರೆ ನಮ್ಮ ಜೊತೆಯಲ್ಲಿ ಓಲಾ ஃபவுண்டேஷன் சார் ನಾವು ಕೆಲಸ ಮಾಡೋವಾಗ ಬರ್ತಾರೆ அவருன்னு.
ஸோ இப்போ என்னன்னா எங்ககிட்ட மோட்டோ ஆரோக்கிய கிட் இருக்கு. ஸோ மோஸ்ட்லி நாங்கள் ஃப்ரண்ட்லைன் ஒர்க்கர்ஸ் கூட தான் போயிட்டு ஸ்க்ரீனிங்லாம் பண்ணுவோம். அப்போ எங்கள் மோட்டோ ஆரோக்கிய கிட்ட வச்சு நாங்கள் பிபி பார்ப்போம், சுகர் பார்ப்போம், ஹீமோகுளோபின், யூரின் ஆல்பமின், டெம்பரேச்சர் செக் பண்ணுவோம், ஹைட்டு, வெயிட்.
எங்ககிட்ட இருக்கிற மெட்டீரியல் வச்சு நாங்களும் பார்ப்போம். நாங்கள் பிபி பார்த்தோம்னா அவங்க ஒரு சைடு அவங்களும் சுகர் பார்ப்பாங்க.
எப்பயுமே வீக்லி விஹெச்என் டே நடத்துவோம். ஓலா ஃபவுண்டேஷன்ல மோட்டோ ஆரோக்கியம் வந்ததுக்கு அப்புறம் அம்பரீஷ் எங்க கூட எல்லா விஷயத்துலயுமே கலந்துக்குவாரு.
ஓலா ஃபவுண்டேஷன் மோட்டோ ஆரோக்கியம் அவங்க வந்ததுக்கு அப்புறம் பாத்தீங்கன்னா நிறைய கேஸ் எங்களால ஐடென்டிஃபை பண்ண முடியுது. இவங்க வரும்போது மலையில இருக்கிற மக்கள் எங்க வேலைக்கு போயிருந்தாலும் அந்த இடத்துக்கே போயிட்டு எங்களால பார்க்க முடியுது.
மோட்டோ ஆரோக்கியத்தினால நிறைய பேருக்கு நியூ என்சிடி ஃபாலோ பண்ண நிறைய யூஸ்ஃபுல்லா இருக்கு.
பீப்புளோட டோர் ஸ்டெப்ல நாங்க ப்ரொவைட் பண்றோம். இதனால அந்த மக்கள் எப்படி பண்ணுவாங்கன்னா அவங்களுக்கு டிரான்ஸ்போர்டேஷன் இருக்காது. ஸோ இந்த பேசிக் ஹைட் வெயிட் கூட அவங்களால மெஷர் பண்ணிக்க முடியாது. ஸோ இந்த மாதிரி சர்வீஸ் பண்றதுல நாங்களும் ஒரு பார்ட் ஆஃப் இருக்கிறது ரொம்ப ஹாப்பியா இருக்கு.
Thank you. Can I go to the slides? Right. Um, so that vehicle goes into all the remote areas across 6 blocks in Krishnagiri. We have seen some amazing uptake in terms of people coming and getting themselves screened. When we talk about health systems, the three prominent things we always keep hearing is accessibility, availability, and affordability. And at times you also think of, how systems are comprehensive, continuous, and complete. What gets missed when we talk about accessibility and availability is the aspect of mobility. Now that applies on both the sides, from a supply side and the demand side as well. How soon a person can reach the health facility and how soon a person from the supply side or provider can reach to the person at the village level who is trying to seek help for. Now that's the gap which Moto Arogam solves for. But our topic is slightly broader. We want to talk about how various community processes, specifically two as I mentioned, has helped us in getting the community start taking ownership of their health. Case in point, VHNDs and PSGs. But a short snapshot on who we are. So we are Ola Foundation. We are 9 years old. We have been working in this space of public health, livelihoods, education, and culture and heritage. Our focus district is the district of Krishnagiri, which we want to build as the model district. Presently presented in 6 blocks right now out of 10. That's the district snapshot. When we first started looking at Krishnagiri as a district, while there is a lot that needs to happen from a health point of view, Krishnagiri also offered a lot of good things to us as well. We started thinking about what's the best approach to solve the health problems. What are the models that have been established? Some worked, some have not worked. Our approach in looking at any health problem from a public health point of view was to see how soon we can give it back to the community or build a model which is built around the community processes. Hence, that's the framework we came up with. We said that we are going to focus on 4 things. Community remains the center of our universe. Then we look at what is the level of literacy and awareness that we need to create. Third, we need to also understand what are the schemes that is there a lack of uptake of schemes. But eventually, what all of it should lead to, engaging the community, making them aware, and giving them enough knowledge of schemes, it should lead them towards self-care. That's where we want to be. We want to be in a system where people own health, people seek health, and people are not kept away from health. Now, in order to do that, there are a lot of interventions that they are listed down there. But these are key interventions which fall under 2 primary community processes. One is VHND or Village Health Nutrition Day, and the second is a patient support group. Now, you will also see an intervention called Samuga Iyakam. The objective is to create a community movement around everything that we do in the village. The more we involve the community, the better it is. Give them enough for them to start owning their own health and the demands for their own health. That's how the 2 systems will start acting. Typically, in a perfect world, no foundation should come and help the people. They should be aware enough to take care of health, and the system should support what they are. Our job is to be the catalyst. Our job is to be the nudge creators. Our job is to be the complementers of what the government is doing. And that's exactly our story. Now, when we started looking at what we need to do in Krishnagiri, we started with what can we do with the community. Then we narrowed it down to what can we do in women's health and maternal health. And then we narrowed it down to that can we look at high-risk pregnancies, because there are a lot of high-risk pregnancy cases, but the contributing factor for high-risk cases will be covered or will get covered under VHND. Hence we chose HRP as a focus on maternal health. We chose our demonstration in 6 blocks, and we said that we will keep doing VHND and we'll keep doing patient support group to get to our objective of achieving women's health and well-being. Now, what does that entail? It entails working on these 6 or 7 key specific interventions and not looking at what VHND traditionally offers, which are more than 17, 18 interventions. We said we'll focus on these. And once we start focusing on these, what does this give us? And there is also an element, one element I forgot to talk about. There is also an element of tech. We've been hearing a lot of AI, we've been hearing a lot of tech and digital today. What we will present today, or I will present today during the course of this presentation, is the tool that we feel which is needed by the frontline health workers. It is not 100% decision support, but its ability to decide and act upon. So it's an action assist tool as well. It's an AI enabled tool which we will present, but that's called Saheli. Now, what is the nudge that we created? The nudges were VHND and PSG. We added 2 more nudges. We added the Moto Aragyam project, as you saw, and you guys can visit outside. There is a stall. You can view the vehicle, leave your comments. Would love to hear from you how you feel, perceive about the program. And then the community gatherings. What we started doing every 15 days is started bringing community. If we are missing out men in the community, we will do evening sessions. If we are missing out adults and girls, which are missed out at majority of the VHNDs, we will go into the community through Moto Aragyam and we will engage there. We will also engage them in the school-based program as well. So the idea is, how do we saturate the population to achieve what we want to achieve from a health awareness point of view and well-being point of view. Now these nudges basically cover these 6 interventions which I touched upon earlier, which give us a very holistic coverage, ending with counseling and referral, which gets missed out because we don't see those people. Now, what does this give us as an output? The nudge gives us an output from a demand side point of view of increased service uptake, of increased presence. Our presence, what we have seen in Krishnagiri in every VHND now has gone from very few to 25 to 30 to 35 people and women coming into these VHNDs. That's a good sort of output from a demand side point of view. But if I look at the supply side, because these 2 sides are needed to build resilience, we did work with the district health officials and especially Dr. Ramesh to start retraining of the health workforce. That has helped us in reinstating the whole SOPs around VHNDs. That has also helped us in putting in a lot of rigor in patient support group as well, which brings in again a lot of people to these 2 sessions. What is the ultimate idea? The ultimate idea is that a message that has to be repeated multiple times, starting from a Monday session at a HSC, which is AN clinic, to a Saturday session, which could be a PSG session. How frequently we repeat the same message over and over again, it starts getting ingrained in the community. They start reacting to the health messages. And that's a win then. It's a time-taking process, I get it, but then that's how you win community, by giving them the right messages. Leading to what I said as nudges, eventually where we want to be. Where we want to be in these 6 blocks, maybe by the next 2 years, is to achieve certain outcomes which are listed here. I'm not going to be reading them, but those are the eventual outcomes that I want to achieve, or I want us as a foundation to achieve for the district when we set it up as a model district. Now, these are both supply and demand side activities, which are the nudges which we have created. In order to do this, like I said, I wanted to reiterate, when we looked at VHND and PSG, we said we will look at 6 key interventions of VHND. And when we look at PSG, beyond what happens on NCD, these are the folks who come to PSGs are senior citizens, are citizens or people who are either seniors in the house, who have the ability to influence the topics or discussions around health in the household. So what is the message we want to give them around while we are doing a patient support group? Can early breastfeeding be a message? Absolutely. Can adolescent health be a message? Absolutely. Can family planning be a message? Absolutely. So like I said, finding the opportunities or the right opportunities to solve for is what we are trying to do in Krishnagiri. And we are not trying to reinvent anything. We are trying to just put rigor to what exists. We are trying to complement in terms of achieving those goals, which the district, in our belief, we feel that Krishnagiri should become a model district in the next year and a half or 2. And that's what our goal is. But there is some journey ahead where we have to go to. That's one intervention which we have been testing out right now. We've created one Nutri Garden in the community. We are now trying to create dietary diversity in the community. The idea is that we will promote kitchen gardens and we will create barter system at the community garden for them to increase the uptake of various dietary practices. Now, just a quick snapshot of why VHND and why PSG. With so many sessions that have happened in the last 1.5 years, VHND gives us the ability to become hyper-local. It's one of those platforms which has been least exploited, but which needs to be overexploited. Similarly, a patient support group is also a platform which needs to be overexploited. There is a lot of peer support. It has to be hyper-local. Unless we not think of being hyper-local, we will not be able to do that. But what is the loop back? Can we link PSGs back to VHNDs and tell people to bring their family or their daughters and daughter-in-laws to VHND? That's also how you improve the messaging. And that's how you improve people's ability to own their health, which we have seen. Now that's for the people's part, which is the demand side. What I want to also talk about, the program that we have been running for the last 8 months has seen a lot of uptake. This program also gets associated with a technology system which I want to touch upon quickly. That program is called Saheli. You can also see the live demo of Saheli outside if you visit our booth. But here's a short video of Saheli that I want to play, which you can which will give you the ability to understand how it helps the health workers with actionable insights. It is not just a decision support. It solves for one critical problem with the health workers is the ability to act on. Most of them are trained to be data collectors. They need to be nudged. That is a system which nudges them to act upon. Can we play the video, please?
Ola Foundation presents Saheli, an AI-powered decision support tool. Saheli enables frontline health workers to carry out early screening and detection of high-risk factors like anemia and other ailments. With this tool, health workers can conduct door-to-door screenings. Equipped with a tablet, the health worker can visit each patient and use the AI-powered context-aware decision support system. The health worker begins by entering the patient's details, asking her age, pregnancy status, and dietary preferences. The system then prompts the health worker to observe physical signs such as pale inner eyelids, tongue, or nails, and to record any other symptoms like dizziness, fatigue, or rapid heartbeat. Next, Saheli guides the health worker to note vital signs, check compliance with iron folic acid tablets, and enter the gestational age. All of these details are processed by Saheli's AI engine, which is trained on National Health Mission and ICMR protocols. Using advanced retrieval systems, the engine interprets the inputs and provides context-aware recommendations, which the health worker uses to counsel the patient on clinical advice, dietary guidance, lifestyle changes, and medication adherence. If required, it also suggests referrals to higher healthcare education facilities and schedules follow-up visits. Saheli further supports two-way interaction, enabling the pregnant mother to ask questions and receive trusted protocol-driven guidance instantly. In this way, Saheli streamlines the entire screening process, empowers health workers with actionable insights, and ensures pregnant mothers receive the right care at the right time.
That's what Saheli does. It makes their job a lot easier for them to act upon. Now, what we have seen is if we apply these two things, one is the ability to access remote areas and ability to give them the right appropriate technology to solve for, it can create wonders in the community. There is a lot of uptake that happens. Where do we see ourselves in the next year? This is where we want to be. We build on the strengths that we see, which the people have provided, which is leveraging VHND and PSG. But we also want to get deeper into the tribal community. That's where the issues of access and availability is. That's where the issue of sickle cell anemia is. We want to get into that as well. And then we really want to look at what is the technology. The key focus from here on and to the next year would be how can we saturate the population? The more we saturate the population, the better we know about the population. And then it becomes easier for us to act on what we have gathered as insights. So with resilience in mind, bringing these two systems together is what we at Ola Foundation have been doing for the last 1.5 years. Please do visit the stall and learn about the program. Please do reach out, more than happy to collaborate as well, because I honestly believe that a single organization or a single intervention cannot solve the health problems that we as a country face. It has to be a collective effort of everyone coming together and solving for it. So hoping maybe by next year, we'll be in a better position to actually come closer to the claim of, with the support of district health officials, Dr. Ramesh and everybody, to take Krishnagiri, make it reach to that point which is closer to being a model district. Model district not only in Tamil Nadu but also in the country of India. Thank you.